Welcome to the concluding part of whiter, brighter teeth. In my previous video, I discussed the different ways you could go about getting whiter, brighter teeth, like home remedies, teeth whitening strips, at home or in office whitening treatment. Whichever method you go for to whiten your teeth, there are possible side effects. These risks are greater if your whitening kit or whitening treatment is not provided by a regulated dental professional. This is Dental Chinwag with Amaka Igwatu. Today's video will be talking about the risks of teeth whitening, tips on how to prevent these risks, as well as alternative treatments when teeth whitening doesn't work for you. What are the possible side effects? This is usually due to the chemicals used in the teeth whitening treatment. You may notice your teeth are more sensitive during whitening process and for a short time after that. This is due to the dentin exposure during the treatment. Teeth sensitivity with whitening treatment is very common. It is usually of short duration, lasting typically 24 to 48 hours. This is also known as chemical burn to the gum. This can occur if the whitening product is exposed to the gum during whitening process. When this happens, your gum would appear white immediately after they come into contact with the whitening solution. Prolonged exposure to teeth whitening gels or solutions on the gum can cause inflammation, redness. In extreme cases, bleeding and pain may occur. Depending on your teeth shade, the result may not be what you are hoping for. Whitening your teeth too often may cause your teeth to appear grey or translucent, as opposed to the white shade everyone desires. Keep in mind, the time it takes to whiten your teeth safely depends on the type of discoloration and the teeth whitening method that you are going for. I will be giving you some tips to reduce teeth sensitivity whenever you're whitening your teeth. If you follow these instructions, hopefully everything should go well when you start your teeth whitening process. Follow the instructions and never whiten for longer than recommended. Try cutting back to every other day once the sensitivity starts, along with shorter application times. This is called the teeth whitening holiday. Taking pain relief before applying the whitening products can reduce the symptoms. Check to ensure you are using a product with lower peroxide levels, for example 6% to 10%. While you may think the higher the peroxide level, the better your teeth whitening result, it is not worth it if you and your teeth are miserable. So trust me, always go for the lower peroxide level. Limit the intake of cold food and drinks while you are doing your teeth whitening treatment. Don't overuse whitening products. When using excess, whitening products have the potential to make your teeth very sensitive and even damage them. Use fluoride rinse or desensitizing toothpaste. This can help reduce the sensitivity symptoms. Fluoride treatments are sometimes recommended before, during, or after your teeth whitening treatment. Use soft to medium bristle toothbrush. Softer bristles are gentle on your teeth and gum, and they can help reduce the symptom of teeth sensitivity while you're having your teeth whitening treatment. Lastly, contact your dentist if your symptoms persist or worsens. If your teeth just won't stay white, no matter how many teeth whitening products you try, strips you slap across them, you might be interested in finding out about alternatives. The following are the alternatives to having whiter, brighter teeth. But you need to remember, these other alternatives are more destructive and usually irreversible. The first alternative is composite bonding. This is a modern way of restoring teeth. It involves bonding a tooth-colored resin material to existing teeth to improve their color. It can last usually between 2 to 5 years or longer, depending on your lifestyle, such as whether you smoke or drink. The second alternative are veneers. Veneers essentially covers the entire outer surface of your teeth, and they are permanently bonded to one or multiple teeth. Even though they are permanent, they do not last forever. You can consider a veneer as a press-on nail. Once it's bonded, you cannot pull it out. There are different types of veneers. Some require grounding down your natural teeth, while others do not require any grinding down. The third alternatives are dental crowns. Dental crown is a tooth-shaped cup placed over a tooth. Crowns, when cemented in place, fully covers the entire visible portion of a tooth that lies at and above the gum line. On average, dental crowns last between 5 and 15 years. These three alternatives do not last forever. You will need to touch them up or even have them replaced. So you have to think wisely before you go for these alternative options, because most of the treatments are irreversible. Irreversible means when your teeth are ground down, they do not grow back. When you eventually consider having these alternatives to whiter, brighter teeth, do not forget that it's very important to maintain healthy gums and good oral hygiene. Thank you very much for watching. Don't forget to share this video with anyone who you think would benefit from it. Like, share, comment, and subscribe to my channel. Don't forget to also leave any questions in the comment section and I'll be happy to answer them.